Hi guys, it's Dr. Ryan with another video review of one of the Step 1 Free 120 questions. In this video, we're going to look at Block 2, question number 36. So this question describes a 48-year-old man who works in Afghanistan. He presents with skin ulcers on his neck and arms for the past 20 days. On exam, there are 6 2-centimeter papular lesions on his head and neck with ulcers at the center of the lesions. And what they want to know is which of the following vectors is the most likely source of the lesions in this patient. And they give us 5 answer choices, which you can read to yourselves. Okay guys, so there are only 2 pieces of information you have to glean from this question stem in order to answer it correctly. The first is that this man has been in Afghanistan, a country in the Middle East. And the second thing is that he has skin ulcers on his body. Anytime you see these 2 things together in a question stem, you have to immediately think of cutaneous leishmaniasis. That is a protozoal infection. It's endemic to the Middle East. So in a board question, it's always going to be someone who's been to Afghanistan or Syria or Saudi Arabia or some Middle Eastern country, and it presents with skin ulcers. When you have those 2 things together, a Middle Eastern country and skin ulcers, that's almost always the diagnosis, at least in the USMLE, is cutaneous leishmaniasis. And then once you recognize that, you just have to have memorized the vector of cutaneous leishmaniasis, and that is the sandfly, answer choice C. And here I screenshotted the section from first aid just to show you where this information is. It talks about leishmaniasis. It has a visceral form, but this question's about the cutaneous form, which presents with skin ulcers. And here's a picture of one on the neck, just like they describe in the man in the question stem. And they tell you in first aid that it's transmitted by the sandfly. If you got this question wrong, do not feel badly at all. These are the type of questions that it is great to get wrong. Once you get this wrong once, you will always remember it going forward. So these questions that test these buzzwordy little factoids like skin ulcers from the Middle East, you just have to get them wrong once and then you always remember them going forward forever. And that concludes our video review of the Free 120 Block 2 question 36.